Welcome and thank you for joining the ASPPH Presents webinar, CDC Public Health Associate Program. I'm Tracy Seward, Senior Director of Outreach and Recruitment at ASPPH, and I'm very happy to moderate this session. I'm excited to introduce your speakers for today. Heidi Pfeiffer and Pamela Craig are on the Partnership Education and Training team with the CDC. You can ask questions at any point today by clicking on the Q&A button at the bottom of your screen, and we will be taking those questions at the end of the presentation. The webinar is being recorded and will be available soon on our ASPPH webinar page. Now it's my honor to hand it over to your speakers for today, Pamela and Heidi. Thank you.
Thanks, Tracy. Hi, everyone. My name is Heidi Pfeiffer, and I'm coming to you live and chilly from Atlanta, Georgia. I'm here from the Centers for Disease Control. I work for a program called the Public Health Associate Program, and we want to thank you first, Pam and I want to thank you first to the Associated Schools of Public Health and, excuse me, can't even talk, Association of Schools of Programs of Public Health, because this is the second time we've been able to come talk to you. We've talked to the program leadership as well, and now we're talking to possible candidates for our program. So we're really happy to be here. So I'm going to be talking later in the presentations, but I would like to introduce you to my colleague, Pam Craig.
There, thank you, Heidi. It's an honor, and I really appreciate the fact that Aaron and Tracy have given us the opportunity to speak to the Association of Schools and Programs of Public Health. And in collaboration with Heidi, I thank you. And I'm hoping that you'll find that this opportunity is a good one, it's informative. And as Tracy said, we'll have Q&A at the end. All right, next slide. And there we are. I am part of the public, again, the Center for Support, Tribal, Local, and Territorial Support, please forgive me. And I've been with the public health program for almost 5 years. And it has been a very rewarding opportunity. But I work for the Partnership and Education team. That's where Heidi and I, we are cohorts together. And again, it is such a pleasure to share this information with you. Next slide. All right, the Public Health Associate Program. And again, thank you so much. The Public Health Associate Program, we call it affectionately PHAP. And we're going to give you an opportunity this afternoon to take a peek into the world of this engaging program. Again, you'll hear us refer to it as PHAP, but it is the Public Health Associate Program. PHAP is a collaboration between CDC and host sites. The host site is actually your host. It is a federal, it could be federal, it could be state, it could be a non-government entity where you will be working on a 2-year paid competency-based training program. And they will host you, meaning you will have your supervisor there. You might have a primary as well as a secondary. We refer to our staff as associates. And these associates are federal government employees while they're in the program. And again, let me stress, PHAP is a 2-year paid competency-based training program. So you have, and it is perfect for anyone that has little to no public health experience. They have some people even have no work experience. But PHAP is a partnership and a collaboration between CDC and the host sites. And the host sites, again, can be state, tribal, local, and territorial health departments. And you may hear us refer to NGOs, that stands for non-governmental organizations. In addition to working with your host site, you will also have a support system. The CDC has what we call PHAP supervisors, and they work in tandem or hand in hand along with your host site supervisors. Now, the job series began in 1948 with the purpose of providing venereal disease control services in the US population back in 1948. They were hired in groups of several hundred per year to fill the need to frontline public health workers in our local and state governments. They also assisted with controlling syphilis and gained a grassroots understanding of the nuances of public health, especially as it related to patient services. Roles expanded into many public health disease control disciplines domestically and eventually internationally. In 1994, this large effort they made was to hire public health associates was discontinued. However, in 2006, a new field-based CDC program began to rebuild the career pipeline for public health advisors called the Public Health Associate Program as we know it today. Okay, next slide. The mission. The mission of public health is critical. Within the mission statement, there is a specific focus on exponential hands-on learning. And when we stress hands-on, and it is again for early career public health professionals, and some of the associates may come in with some professional experience in other fields, and for others, this may be their very first professional job. 91% of the training for the associate is exponential. 9% of it is academic. And what we mean by that is you will spend 3 weeks in an in-person training, monthly webinars, self-paced learning, and different activities. And at the same time, while you're doing these activities, you again will have immediate access to your PHAP supervisor as well as your host site. Next slide, please. What will PHAP look like? So what does PHAP look like? This is what it is. You see, we've got people that are preparing for vaccines. Now we have someone, that picture might look like a gas mask, but it's probably, we're gonna say it's a very, very safe shield so that it doesn't scare you. You may even be working with an NGO right in the community where you might be helping some of our senior citizens or septuagenarians learn how to rehabilitate themselves. This young lady is helping him put on his shoes. You also may be doing community support as well. There's a lot of things that go on with PHAP. Again, it's hands-on and each individual host site has unique tasks and responsibilities. Next slide, please. Now, if you look at this picture, you're gonna probably wonder, why on earth do we have this picture? That person that you see, we put an arrow there, he is PHAP 2. Yes, he is. The PHAP, the whole program is exciting, and it's a wonderful thing about PHAP is that you never know where it might take you. You might be in a very rural host site, which this young man looks like he's doing, and you can see it's far and wide, pretty flat, see the clouds and the fields, but there's one of our associates, and this is a real picture. So you could be in a real location, or you could also be placed in a big city location, or also in a city or maybe a suburb of a major city doing community support services. PHAP is everywhere. Next slide, please. This is PHAP. As you can see, our PHAP associates make up a really diverse group of individuals. We come from all walks of life, different races and cultures and educational backgrounds, male and female. We have a wonderful, wonderful time, which I hate in this pandemic, we don't have as much opportunity to meet some of our cohorts, but I tell you, it is fun, it's exciting, they love getting together, and they really, really like meeting each other. And it's a support system as well, but we're diverse and we come from all walks of life, and again, educational backgrounds. Next slide, please. Now, we've talked a lot about what PHAP is. Let's talk about what PHAP is not. We're not an internship. This program has a set predefined set of work activities. The work assignments are submitted and approved. So every activity that you touch has been approved, it's gone over, it's relative, and they make sure before it's submitted that it is approved. So you're not an intern. The associates are not administrative support personnel. We don't get coffee, we don't make coffees, we don't go pick up lunch, and we don't wait to be asked for the next task. Associates are not guaranteed a job after training. However, we are a training program, but not a job placement program. Associates are field assignees, and you'll hear more about that later. They have no legal authority to represent or speak on behalf of CDC, which means speaking to the media. CDC recognizes them as associates. They are not subject matter experts. And our public health associates are entry-level, early career public health professionals. Next slide. Now, this is important because this garners a lot of attention. The eligibility and criteria. One of the things to be eligible is, first of all, you have to be a U.S. citizen. You have to be a U.S. citizen. And PHAP focuses on recent baccalaureate graduates for associate positions. You have to be committed to public service, have a passion for public health. You have received a university or college degree within the last 2 years. You must have a GPA of at least 3.0. Be willing to relocate at your own expense. Be willing to commit to full-time work for 2 years. And again, we cannot stress more, you must have a passion for public health and definitely flexibility, because as you know, the best laid plans, actually, when you get to that host site, many things may take a turn or a twist. So having that flexibility, the compassion, and the empathy for those that you come in contact with is a plus. Next slide, please. Now, one thing I'd like to share with you, this is a snapshot of where the road begins. You heard of the yellow brick road? Well, this is kind of like the blue road for CDC. This is called a snapshot of USA jobs. What do I need to do? The first thing you need to do is to set up an account for USA jobs. This is very important because the information that you share with us on USA jobs, it's going to follow you all the way into the very onboarding process. So if you put your name in lowercase, it's going to show up everywhere across CDC in lowercase. If you have a name, a surname, or a married name, or a hyphenated name, it's going to follow you until we onboard you. So take time. This is something that you can't do while you're watching television or participating in a blog or a chat or TikToking. You need to have some time to really sit down and give yourself time, maybe in the morning if you like. Get that cup of coffee or that tea, start from the beginning. It has a lot of nuances to it. It's not the latest and the greatest. It works, but it's not the most up-to-date. So there are a lot of places, there are twists and turns that you're going to have to be aware of. But this is where you start. And it's very important. That phone number you put in, make sure it's a good phone number that we can access you, even after college. A lot of people, for email addresses, they use their school. But once you've graduated, some schools don't allow you to use their domain anymore. So make sure you've got the name the way you want us to pronounce it and use it. Make sure you have a good phone number that we can always reach out and contact you, and a very good email address. You may not realize it, but we do. If we have to talk to one of our associates during the onboarding process, we have no problem over at our HRO, our Human Resources Office, reaching out, giving you a call, saying, hey, Jim or Sal or whomever, we need to have a good email address, a good phone number so we can contact you and so that you can contact us as well. Next slide, please. The application process. This is important. Now, once you have completed your USA Jobs profile, this is kind of giving you a snapshot of the different phases. You will notice that the 2021 class, we call that our upcoming 2021 class, the application processor period opens January 20th through the 27th. Now, I'll give you one tip. Usually around the last week in December, they may have already updated the information. Any new information that they want the public to see, they will update it. So it won't hurt to check the last week of December, but the application process actually starts January 20th through the 27th, and it's not a long time. During that application process, candidates will apply in USA Jobs, which is what we showed the slide previously. The next thing, once you have applied, there's a system in place that based on the information you put in, they will determine who they will certify to be invited to be selected and provide a written response. We call it a personal statement. Most people, because it doesn't matter what your educational background is, if you meet certain criteria, they will invite you to submit a personal statement. And it's a written response. All of the instructions and details are there to guide you through it. The next phase, once you have made it past the personal statement phase, is the interview phase. That's where you'll be invited to do a Skype interview. CDC staff will interview you and score selected candidates. Many of the people that you'll be interviewing with are current PHAP supervisors. They will do the interviewing. When we'll go over those steps later on as well, but we want to ensure that the right candidates are selected for participation in the Public Health Associate Program. It's a systematic, multi-step process that's been established, and it works. Candidates, again, apply through USA Jobs, get comfortable with it, get familiar with it. The Human Resources Office here at CDC, again, they determine the qualifications. Throughout this process, there will be a reduction in the number of eligible candidates. At the end, a target number of candidates will be reached. Now, here are some of the benefits of you putting forth your efforts in this process. Next slide, please. The benefits. I guess you say, after all of this, what are the benefits to me? Well, first of all, you'll be a CDC employee with salary and health benefits. We know that this is very important. Associates are employed by CDC as a temporary field assignment and receive a salary, paid sick and vacation leave, health insurance, and access to a variety of free services such as legal, counseling, financial planning throughout and that's through our Employee Assistance Program. Many of you are familiar with what we call EAP, but that's our Employee Assistance Program. Assignments are individually tailored to give each associate a broad work experience and meet the local needs of and delivery of the public health services, such as case investigations, disease surveillance, health promotion, community outreach, and public health administration. At a minimum, associates will work in 2 separate program areas and become trained as a Tier 2 emergency responder. Associates develop career skills throughout these 2 years with hands-on experience, training at the CDC in the field, and supervisory support and mentorship. So not only do you have a support system at your host site, you also have your PHAP supervisors, and then they pair you with a mentor. And we're working on a process right now. Some of the current PHAPs, they have a buddy program. So you've got many, many layers. We're not going to send you out in the fields of some rural country without support across the US. Now, upon successful completion of this 2-year program, associates are highly qualified to compete for entry-level career positions at the CDC. And you will be a CDC public health advisor, equivalent positions in state, tribal, local, and territorial health agencies. Heidi will now show you more and additional information about the benefits of being a public health associate. With that, Heidi, I'm going to let you take it away.
Thanks, Pam. Thanks. Let's just stay on the slide for 1 second. I wanted to highlight something that's really important. One of the mainstreams of our program is that you are a CDC employee for those 2 years with us. Because you're inside CDC, you technically can apply for jobs that are inside CDC that the public doesn't have to apply for. So what's really important about this program for you to understand is that at the end of your 2 years, many programs at CDC will offer positions for the associates to apply for, which means that people from the outside cannot qualify for or even apply for through USA Jobs. So when we talked about it being a job training, it is a job training program, but it's not a job placement program either. However, the advantage of this program is what the CDC, other centers and offices in the agency recognize is that these are 2 years, 2-year-old people that have worked with CDC for 2 years and have a knowledge and a skill set that they want to hire from. So that's just a really good benefit that I wanted to kind of highlight on Pam's slide. Another benefit that we're kind of seeing most recently, next slide, please, is the need for our associates to be responders. You know, PHAP was not created just to be the responders for measles and outbreaks, and as you said, syphilis, Pam, back in the 50s and 60s. But we're seeing now that our associates, who we refer to them as PHAP associates, are being utilized as responders for the EOC, the Emergency Operations Center here at CDC. As you can see on the slide, we've been used for Ebola, Zika, measles, and I can't tell you, as of just this morning, we've got some of our staff that were hired 2 months ago being involved in the COVID response, first in the prevention and the education, and now in the vaccine distribution. We've got a long way to go with the vaccine distribution and campaign, so I have no doubt that our associates will be involved in this. So those are actual pictures of associates that have actually responded during events, and this includes also natural hurricanes as well as emergencies at the local level. One thing I want to really talk about, my part of the section here, is talking about how do we get to be a PHAP associate. Next slide, please. I think the biggest thing you have to understand is that just like you guys are now, your coursework is based on competencies and you have curriculum. CDC PHAP program also has a curriculum. It's a competency-based curriculum. We have 9 domains. We're in the process now of updating them to include an emergency response component of it. But these are these are competencies, and these are skill sets that you pretty much would be learning in a normal day job. You know, how to communicate, how to critically think, how to be professional. We'll teach you the science. You don't need to know anything about public health. And I don't mean to make it sound like that, but we really want people who want to work in public health, who have a passion for public service, and also somebody who really wants to do well within the public population, population health, which is this nice new I can't even talk today. Buzzword we're seeing nowadays is population health. So I think it's important to understand that we are based on competencies that are reviewed on a yearly basis. And then just recently, we are reviewing our competencies now for the next level. Next slide. This is probably one of the not most important slide set, but I want you to take a look at this because this is how we find you. This is how you can get a job with CDC working as a public health associate. We want the best fit, BEST-FIT. We want the best fit. We don't want the smartest. We don't want the brightest. We want everyone. We want someone that fits every single section of this. We want to make sure that the people who will qualify and people we choose can look at life in a bigger picture. Beyond the experience of just working in the field, we want to make sure they understand that PHAP fits in not just for a patient, but it fits in for the population. We want to train you as public health generalists, something that you can go and do if you are working in STD for the 2 years, that you can take that experience and work into medical school or nursing school or go on for your master's or work in a completely different field. One thing that PHAPs are not is they're not subject matter experts. And that's something that Pam did talk about. Effective communicators, that's huge. We want to make sure that you can communicate. I'm a New Yorker. I talk very fast. I have a hard time slowing down. As you can tell, Pam and I are a nice combination because I tend to go, 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 go. What we try to do is we want to make sure that the candidate comes out with succinctly and accurate skill sets that they can communicate with any population. And that's one thing that we really do take pretty seriously, especially when it comes to working with socially and culturally different dynamic communities. We want to make sure that you are inclusive. Public health professionals always work and frequently work with individuals from different social or cultural backgrounds. There are many differences in races, religion, ethnicity, gender, age, sexual orientation, we all know, and even philosophical views, even as of currently. We want to make sure our candidates are respectful of these differences, that they're free of acting on prejudice or bigotry. We want them to be unbiased, tolerant, and accept all differences. We also want to make sure they can thrive in a dynamic environment. You've got to be someone who can deal with changes quickly. Changes happen all the time, and look what's going on in the world right now. Public health is fast-paced. It's responsive. We respond, we adapt. Candidates should be able to apply lessons learned from their host site supervisors and from their PHAP supervisors. Take the scientific approach, learn the evidence, make changes as directed, but respond quickly as a team. Flexibility is something that you're going to hear from our program, and I hope from every single teacher that you work with. You've got to be flexible, okay? We want you to be able to adapt quickly in an ever-changing world. And we also want to make sure that you have a positive attitude. It's kind of hard right about now sometimes to be positive, but I'll tell you, the chemical changes in your brain when you're happy and smiling are much better than being down and low. So we want to be able to make sure that the candidate that we choose can function despite uncertainties and frequently changing work conditions. You know, there's times I know with my boss that I'll say, you just told me to do that. Yeah, but I need this. But you said you needed this. I need that. It happens, and we've got to be flexible. Intelligence. Well, I'm not talking about the 4.98, whatever levels they're using now. I mean, I was in college. I think Pam, ours was 4.0. Now they have fives and stuff. But we want to make sure someone is intelligent. We want to have an academic success. We want to prove an academic success. I didn't do great my first couple semesters of college, but I've definitely improved in my career and my academic career. And what we want to see is we want to see a track record, and that includes volunteering, things that you've done outside of the school setting. We want to make sure that you can comprehend ideas, apply new information at any situation, and that's where that intelligence comes from. And tactile learners, Pam said to you that these are experiential training. You're out in the field. You're actually at a health department or an NGO or a community-based office or a tribal nation. You have to be able to be physically there at that facility working. We know it's we know it's a change, we know it's a move, but PHAP is primarily an on-the-job experience training program. Associates are expected to learn the structure of where they're at, the public health program they're working under, but we want to make sure they're delivering exceptionally public health great service. We want to make sure they're meeting all the competencies and also making sure that they're meeting all the technical elements that the CDC as well as the federal government requires them. They belong to CDC, but they are effectively people that work at the state or local level, staff members. Just like Pam said, they're not interns. Next slide, please. Here is a beautiful map of our class of 2019. This is, you can see kind of pretty much where we've got most people and how they're distributed. It depends on the number of host sites, as Pam mentioned earlier, who applies. For example, you can see in Florida, we've got 9, New York, we've got 15, and California, 13. Well, there's a lot more people in these states, and we get a lot of host sites that want to apply. The goal right here is not for us to be everywhere. The goal is for us to be where the need is. So if there is a need in Florida or Texas or Idaho, then that's where those host sites come in from. And it's really just kind of give you a little bit of a visual. Next slide, please. We don't have a map yet of the 2020s. That would be way too cool if we did. But I did want to talk to you a little bit about the cohort that we just hired in 2020. On October 13th, and Pam was actively involved in this, we hired 185 associates out of, I think it was close to 3,000 applicants, Pam. I could be wrong or making that up. So yeah, around thousands of applicants. We started, and that's the breakup. We look for baccalaureate level people to come to our program. It does not mean you can't come here with a master's or even a doctorate level. The idea behind this is that you come here with pretty much mainstream interest in public health. We know right now jobs are not aplenty, and we know people can't get positions. And a lot of our people who are getting bachelors tend to go on for their master's. That's okay. That's fine. You're still going to be learning the same kind of concept, and you'll still be held to the same curriculum. An example I wanted to share with you, I was a supervisor for about 8 years with PHAP before I came to the training team. And I remember one of my, I shouldn't say favorite, but one of my really well-developed associates was a gentleman who had a bachelor's degree in theater. So he made it through the application process, made it through the interview, made it through the personal statement, and I was supervising him. And I thought to myself, or I was interviewing him. I thought to myself, this is going to be really interesting. He hook, line, and sinkered me. And the reason why was his skill set that he brought to that table was the passion, was the commitment, but also he knew how to talk. He knew how to communicate. He could convince people that he was an actor, which means maybe he could convince people to wear a condom or stop smoking or eat vegetables. You know, I kind of was trying to make his skill set into what I think it could be in the 2 years. So I want everyone to know, like Pam said earlier, you do not have to have a bachelor's in science or a bachelor's in public health. And I loved my gentleman who was in theater, because he taught me a lot about communication. But the whole idea behind this whole program, the public health program, really is to take the people who are best fit for it, the people who want to work in public health, who want to work for a premier agency like CDC, and be the best they can be. Next slide. Where are our class of 2020? Well, right now, here's a little bit of a breakdown where they all are. As you can see, they're primarily within health departments, because that's where most of public health actions and services come from, is at the local or state level. We have a few people on Native nations. We've got 10 people on tribally focused agencies and territorial health departments, which would be Guam, USVI, Puerto Rico, Mariana Islands. NGOs and CBOs are like the American Health Association or other agencies that aren't federal or aren't state or aren't governmental in nature. We've got a few people at academic institutions that actually do some field work. And then the federal ones you're seeing right there just for 2020 are our quarantine stations at CDC. We really want them to learn public health in the field. And because CDC does have some a component of field, which is our quarantine stations at the airports, we did place them this year. And a lot of it was in response to COVID as far as the activities. So next slide, please. Here are some of the programs that you work in. Now, public health is wide. Public health can be STD, it can be public health preparedness, it can be environmental health, it can be digging wells, it can be testing water at the beach, it can be going out to find someone who's got gonorrhea, or it could be finding someone who needs their immunization. The examples here are listed because they're the most common ones, but we've had people in host sites apply for specific programs: diabetes, injury, maternal child health, or even mental health, suicide prevention. So as you can imagine, the topic is different. And what we say about this is that you don't have a choice where you work, because public health is public health. You do this work for 2 years. After that's when you start choosing, I know I like immunization, or I know I don't like immunization, or I really want to work with people, or I really want to go to medical school. These 2 years are meant for you to work in these programs to get your feet wet and kind of get your idea of what public health is all about. We want to make sure that you walk out of our agency knowing what you want to do, hopefully, at least for the next couple of years, not in life, because we know, I don't even know what I want to be yet for the next 15 years. But we do know that we want to give you the capability and the skill set to be able to make a determination later down the line as far as things you like and don't like to do. That's just an example of some programs that we have here at CDC that the host sites support. Next slide. I'd like you to meet one of our associates, and she's going to talk to us a little bit about her experience.
I chose PHAP.
As we said, flexibility is very important to have when you're working. So thanks a lot, guys.
I chose PHAP because working for the CDC is a once-in-a-lifetime opportunity that I didn't want to pass up. I am located here in Atlanta, Georgia at Healthy Mothers, Healthy Babies Coalition of Georgia, where I work with a diverse staff of women who hold me accountable, and I have a high level of responsibility there. What I love most about my experience is that my executive director and my host site supervisor have acknowledged one of my weaknesses, which is public speaking. And any opportunity that I get, they send me out into the community to speak about our organization, and I really appreciate that because it shows that not only do they want to see me grow professionally, but personally as well. And I appreciate that, and I just have had a once-in-a-lifetime experience.
You know, one of the things I took out of Jamila's presentation is that, you know, her weakness. You know, one of the things that's really nice about this program is that we're not expecting you to do the best of the best right now. It's a training program. So I used to tell my associates that it's okay to fail. It's okay to not do right because you've got this backup. You've got someone at the host site who really wants you to be successful, as well as someone back at CDC who wants you to be successful. So, you know, Jamila not being comfortable with public speaking, you know, we nurture that. We give them tools, we give them skills, we kind of make them be comfortable at it. So I want you to get an idea that this is a typical associate, and see how smiling she is, how happy she looks. That's kind of what PHAP's all about. It really, truly is. We really, truly are an agency that wants our program within the CDC, and as an agency, we really want to improve the pipeline for public health professionals locally. We want to make sure that we get the best fit or the right people in the field. Next slide, please. Getting near the end of our presentation, I just wanted to kind of review some of the timelines that are happening. As we mentioned earlier, the applications for this process starts January 20th, and it goes to the 27th. The best place for you to go is going to be on our website. We'll share about that. But because, of course, we are a government agency, it's not something we can turn around pretty quickly. So the timeline there might look a little distant, meaning we're applying in January and we don't start till February. Well, we work for federal government, and it can take a little while. And we also have to make sure that we give opportunities for host sites to apply. And you'll see that from February to April is when we start reviewing all the applications. And we, like I said, we've gotten thousands and thousands of them during each year's. Back in May-ish, June-ish is when we start to do some matching. And then July is when you start hearing from us and telling you, congratulations, you've been accepted to the PHAP program. Would you be willing to go to blah, 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 doing blah, 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 blah. And then you say, yes, oh my gosh, yes, of course I would love to. And then in October, we have you start, just like we started the class of October 13th, the class of 2020. And that class was unusual because we had to do all the onboarding virtually. Normally we have you come to Atlanta and we get you your badge and your computer and everything. And well, this year we're doing it a little bit differently. So we're definitely demonstrating our flexibility. But this is just our timeline. Next slide, please. You saw the slide on Pam's presentation. I'm showing to you one more time. USA Jobs, get that started. That's where your application is going to be applied or put in. Once you pass that step, if you get chosen for the certification, you'll be asked to write up a personal statement. And then you'll have a one-on-one interview with me, myself, or any other of the other staff here at CDC to find out if are you the best fit. And that's probably what the most important part of this conversation really is for you to understand that we are looking for the best fit. We want people who are completely passionate and can take the flexibility of unchanging needs or changing needs and changing goals. We want to make sure that you can be flexible. So this is just one more time. We want to show you that slide. Next slide. Okay, what do I do now? Very, very easy. Go look at our website. Everything on that www.cdc.gov/PHAP has every piece of information Pam and I spoke about. If you're interested in applying, that is the link. Now you'll find that link on our website, okay? Share this information with other people. If you've got colleagues or friends of yours that you think, wow, they should really be in public health, tell them about the public health program. Prepare to apply next year. If you're not graduating until next year, that's okay, wait. Get ahead of the game. Get your USA Job application in there or your USA Job account set up. But we want to make sure that you understand that this is coming soon, January 20th to the 27th. Do not wait to the last minute to apply. Get your application in there. Learn more about it. Search PHAP on the website. There's Facebook pages. There's blogs everywhere about what PHAP is all about. But we want you really we wanted to on this call, which is unusual because normally we don't really have to recruit for candidates. Like we said, we get thousands, but this was a great opportunity with the association to be able to reach a lot of you and talk to you a little bit about the program and answer any of the questions that we could. Next slide. And I think that's it. So what we'll do now is we will turn it back over to our facilitators and Pam and I are here to answer your questions.
Thank you. So as I mentioned before, the Q&A box is at the bottom of the screen, and I can see that we've gotten tons of questions. So we will start at the top. So what I noticed, one of the eligibility requirements is to have graduated college within the last 2 years. By college, does that include graduate degree programs or undergrad only?
Pam is our HRO specialist.
Yes, what they mean by college or university is long as you have your most recent graduation. It could be your bachelor's, or if your most recent graduation within the 2-year span is a master's. We've even had some that are doctorates. But as long as you have not been out of that conferred program more than 2 years, it's not necessary to send your bachelor's, your master's transcript, and your doctoral, and let me just say, nor your high school transcript. We only need the most recent conferred graduation and cumulative or total GPA within the last 2 years. That's the only one that you would need to submit, and it has to be an official transcript from your college or university.
Great. And on eligibility, we have a couple of questions about being foreign student or foreign graduate, and also permanent residence and the eligibility there.
Go ahead, Pam. I was just going to say permanent residence.
One of the things I know, and how do you jump in? Because one of the things, you have to be a U.S. citizen or have certification or be able to prove as a student that you're here. And how do you jump in about I think it's a visa?
Yeah, permanent resident or visa.
Permanent resident or visa. But you can't be a foreign international student
Right.
that lives permanently somewhere else. You have to be one or the other.
Okay, great. And if you graduate in the spring of this year, 2021, are you eligible to apply?
Yes. You are.
Yes.
Perfect, Pam. We love that. What the date, basically, if you can give them an idea, Pam, of when they would need to have that date confirmed as far as their graduation. It's you figure they're applying.
Okay, if you're applying for the class of 2021, you would have to have a conferred degree no later than, now they did make some extensions from July to like August or September this past year because of the pandemic. And some of the colleges and universities, their offices were not open. But as long as you have a conferred degree from a college or university by, say, between July and August of 2019, you're fine, because this is the class of 2021.
Great. Now
so
on to
2018, that would not meet the eligibility criteria.
2018 is too far beyond. Okay.
Right.
So in terms of where people are headed, two questions that are similar. One, can people rank where they want to go? And also, are they in the same location for the 2 years?
Let's talk about that. When we first started the program, Pam talked about what the old-fashioned public health advisor series was all about. And that's really what we are. That's what I am, as a public health advisor. And Pam's in the public health analyst position as well. Because we started so early, we only had like 12 and 15 and 30 and 60 number of classes or candidates in each year from 2007. We've grown now where we've got 200 in one class. Because of that, we've got to have 200 host sites, which means the number of people promoting and representing host sites have grown. This last year, and I think the year before, we were able to say, if there's a choice, where would you like to be? West Coast, East Coast, South, North? Would you like to be rural, urban? Would you like to be in a Native Native American tribe? Would you want to go international, like for example in USVI or Guam? Historically, we never did that. Basically, the goal was for us to, you took the job, you moved where you had to go, you worked for 2 years, you gained those skills, and then you basically went out and did whatever was your next step in your career. But just this last couple of years, because we've gotten so big in the programs, need is there. What we've been able to do is honor those requests. I'd like to stay in the East Coast. I'd like to stay in New York. But what that does not guarantee you, though, is that we're going to get a New York host site. So we'll go to your second choice. I'd like to stay in the East Coast. Well, is there one in Maryland? Is there one in Delaware? Well, I wouldn't mind working maybe down towards North Carolina. We try as best as we can to do the matching so we don't put too much burden on associates for moving. So you don't have a choice where you're going. All we give you is the choices that we have to offer you. So I hope that clarifies it, and it's somewhat kind of like, yeah, you do a little bit. We're not going to send you to Alaska if you're a New York City person and you're like, I don't think I could do it out there. I couldn't do it out there. But we definitely, in the last year or two, we've been able to really kind of tailor these positions and these placements to be a little bit more appealing and easier to adapt to. Pam, anything to add?
One thing I wanted to add to that, what Heidi just said, it is a preference. And as she said, there are regional preferences. And I would say probably 85 to 90% of the people that identify a regional preference, they get that preference. Now this year, because we had not only host sites, state, local, non-governmental NGOs, they offered something a little different. They even gave you a program area preference. So if you had a particular program area preference, that program area might be more prevalent on the West Coast. It could be in USVI, it could be in Puerto Rico, it could be in New York City, it could be in Detroit, Michigan, Chicago, Illinois, or right here in Atlanta, as our associate indicated on the YouTube screen. So the preference is being given now, and that's something that we didn't do before. We stuck to 3 regional preferences, and it covered several states, as Heidi indicated. But now we are given, because we need so many more public health associates, we are asking also, what is your program area preference as well?
Great. There's a lot of questions also related to salary. So I'm going to kind of talk about all of them, about the GS level that you go into and if it's different if you're a master's student, and also if the salary is enough to cover expenses without having to get a second job.
These are great questions. You start off as a GS5 the first year. The second year you go to a GS7, which then makes you qualified to apply for a GS9 as a full-time employee after the 2 years. So the advantage of the PHAP program is it works you through three grades within 2 years, that's probably one of the biggest benefits. As far as the salary is specific for each location and jurisdiction. You can easily find out what that means. For example, in New York City, you're going to get a cost of living increase because it's New York City versus Cupcake, New York, or Cupcake, Kansas, where it's going to be not as expensive to live there. Hawaii, USVI, things like that. So it is determined at where you are placed. So there definitely is a change, range within the salary. And that's all you have to do is look under GS, general, what's GS, Pam? What's my GS?
It's a standard table. It's a
the table.
Government standard table, and they
It'll
look at it.
The grade. Yeah, it'll tell you the grade. And then also what's nice, that the salary can range between $30,000 to $40,000. Now you're asking me, can someone live on it? Well, they do, but it's tough. And a lot of associates do have second jobs because it's starting off early entry first job. And that's the whole idea behind this career. Now there are no increases because of masters. That's not something that CDC has looked into. We used to have a program that was called the Public Health Prevention Service, which was a master's program. And the salary was, of course, starting at the 7 and 9 level. But right now it's a GS5, GS7, and we take in no consideration as far as masters.
Okay. A couple of people want to understand about flexibility, and can you either do this program while you're enrolled in a master's program, or can you complete it during a gap year?
I'm never going to tell someone not to go to school. That's probably the first thing I would say to you. But I'll tell you right now, it's definitely, you're a CDC employee, you're a federal agent, you're representing the CDC and that host site. So if there are things that you need to do in the evening that, for example, like a health fair or something, and you've got class, me as a supervisor is going to say to you, Tracy, you have to go to work. So we do have many of our associates get their masters while they're in the program as well. Some of them take night classes, some of them do them all online. So it is definitely possible. But the one thing we do want you to know is that you are in a training program, which means the requirements can be a little bit different than just a 9-to-5 job. It might be a weekend health fair that you've got to go to, or you might be deployed for a hurricane because it just hit Miami and you don't have any power. So definitely, I think it can be done. But as CDC staff members, I'm going to tell you as a supervisor, you've got to go to work, Tracy. You have to go to work.
That makes sense. Thank you. There's a few questions in here about the 3.0 eligibility and how strict that is.
Okay.
Well,
now the eligibility criteria is a 3.0, but I will tell you, they will, it's a 3.0 and it depends on the number that they're looking for. They might go to a 2.95, but that's kind of, it depends on the number of people that they are, the positions that they're willing to fill. But the main thing is if you got a 3.0, but if you got like a 2.94 or 3 or 2.92, that would not be considered eligible. That criteria would not be met then.
Because there's probably 700 other people that have a 3.0 that applied for you.
Yeah. So if you have a 2.97, they will round up.
Oh,
if you have
come on.
2.9 or 2.98, they will. But the gold standard is the 3.0, but I can tell you they will not go below a 2.95.
Great. How about if you currently are at a higher ranked GS in the government right now, will that work experience make this person ineligible to apply to the program?
Okay, that's an excellent question. Excellent question. If you are a current or previous federal employee, there is a department within the Human Resources Office. They have a different schedule and a different scale. Let's say if you make it through your personal statement is acceptable, your interview is scored high, and they match you with a host site. One of the things when we make what we call a verbal tentative offer, we will ask you if you have current or previous federal employee, if you are a federal or previous federal employee. It depends on your length of service. They will reach out to you separately because there's a different scale that they look at. It might work to your advantage. It might not. It is not a guarantee. They have a really strict and stringent criteria that they use to determine that. So if you are, like we had some people that we brought on in the 2020 class, they work for the Veterans Administration. They may not have gotten an increase in salary, but because of time served, they might have gotten, one day down the line when they retire or vacation, they were able to bridge that. But a representative that deals strictly with that, they're a specialist, they will reach out to those individuals. Always identify yourself. There's certain standard forms you must supply. If you're within the federal government, you'll know what an SF50 is or SF75. And there's certain information and criteria that you must meet. But those specialists reach out to you and they have a separate conversation. And we want to do the very, very best by you and for you. So it's not a guarantee, but always bring it up and they will ask you for the documentation, and that specialist will work with you to try and see what are your opportunities.
Great. Would you say that's similar if you have military time and service, how you were describing? How does military time and service impact?
Yeah, let me talk a little bit about the military time and service. With someone who has a military experience, what we do is we allow that time frame, as we said, you've got to have a bachelor's or a degree within 2 years. That's extended to 6. So if someone has received their bachelor's 4 years ago and they were in the military, they get to qualify for our program up to 6 years. So that is the first thing I wanted to share. As far as military salary, I don't think there's that much of it. And I want to say it's more related to time in service. It'll count as your time in service, right, Pam? But as far as salary, you won't be coming in as an 05 or an 08 or anything like that.
No. But again, a specialist will reach out to you. So when you on all of those forms and on USA Jobs, there are more than one form within USA Jobs, and they ask you specifically, what if you got military service? Was it deployment? Were you discharged? They ask very specific and strategic questions, and a specialist, again, will reach out to you because we want to do the best for you and by you.
Awesome. Several people have asked if there are recommendations required, and if so, how many are part of the application?
Oh, you mean letters of recommendation?
Letters of recommendation.
At this point right now, I don't think we've required them for any of our, we did a long time ago, but not now, no letters of recommendation.
No, they don't, they never ask that. Good question, but no, it's not part of the eligibility criteria. Okay.
Can you talk a little bit about how the placements are different now in COVID, if at all?
It's COVID. One of the things that's really important to see is that public health has changed. Public health departments and agencies that work within public health have goals. For example, a diabetes association is going to be working mostly with diabetes patients, and they're going to want to make sure they get reach out and outreach to their clients. Well, during COVID, it could be that they're reaching out to make sure that they're safe, that they're getting tested. So the mission and the goals and objectives for CDC has changed, as well as health departments. I have no doubt that the cities in New York and Miami and Seattle and LA County, that's all they're doing. Sure, there still has to be work being done with maternal child visits and things like that, but it's at a lower level, and sometimes our priorities have got to be shifted. We see this in a lot of times in public health with HIV. When HIV came out, everybody was doing HIV. Same with Ebola and Zika. We jump into what is actually, we say, the bug du jour at the time. but the positions have changed. You'll know pretty much you'll be working within the public health program. And what's nice about this is that you'll know what the competencies are. Those are on our website. You can see what you're going to be learning. A host site application has to match those competencies. If they don't match those competencies, they don't get chosen. So pretty much everyone's going to be doing something similar, but it could be different specialties, meaning one could be doing work with HIV, COVID, half a day, STD, maternal child preparedness. So it really depends on the agency itself. But right about now, we're seeing a lot of COVID work, a lot of education, and I think probably in the next couple of months, I think it's going to be mass vaccination.
Great. There are so many questions and we are running low on time. So a couple of quicker ones. How many hours of a week does the full-time commitment entail?
5 days a week, 40 hours.
40 hours.
And if you are working abroad or in a remote location, do you live with others in the PHAP program, or is there any?
There's no abroad. You get your own apartment. It's all within local. If you get a job at the USVI, we try to help you find an apartment, or you find some PHAPs that are there and share. We unfortunately can't get too involved with helping you because we're not a staffing agency, but we can put you in a group of people that, because we're so big now, we can say, here's the Virginia folks. They might be able to help you. Mm-hmm. Our alumni is pretty big.
And do you, do you help any with relocation costs? Okay. And a clarification, if you're an F1 holder, are you eligible? F1 visa holder.
Say that one more time.
If you're an F1 visa holder, are you eligible?
I don't know that answer. I'm not sure what F1 visa means.
Not sure. Yeah, I'm not sure.
I'm guessing no, based on your description and my somewhat knowledge of the F1 process, but sounds like something they should follow up with you via email.
Yeah, definitely. And there's a PHAP website. There's questions and answers. You can put a question there and send it to PHAP and ask those questions.
Mm-hmm. Yes, they've got a really good FAQs.
Great.
Sheet on there.
And another clarification. I know you said 2018, but I was thinking you meant May. So is December 2018 too late still? If you applied and that's when you graduated.
Okay, if you graduated December of 2018, it has to be, yes, you're outside. It's outside. It has to be a conferred official degree 2019 or earlier. Okay. I mean, later, I should say. Okay. So if you graduated in 2019 or the spring or the summer, you're scheduled to graduate of 2020, you're eligible. Great.
And then a couple of questions. If the decision binding, if you are accepted, do you have to enroll? And then somebody else asked, if you decline the PHAP offer, does it impact your future decisions if you want to apply again?
Absolutely not.
No, not at all.
And it's not binding.
Life happens. No, it does not.
You can decline it. Okay.
That's correct.
Is there anything in hospital administration?
At this point right now, we've not gone into the hospital side of that. There are fellowships within the hospital HRSA, which is the federal side of the government. They've got fellowships which you might want to look into, but right now we're not working with hospitals because that is more strictly on patient care. And we're dealing more with population health and public health.
Okay, I think we covered as much as we can.
Gracie, you were going, I saw your face going crazy.
I know, I'm just like trying to scan. There's a lot of similar questions in there. So hopefully you all got your answers, but if not, there is a website, like they were saying, the PHAP website has lots of information on it and ways to contact and find out more as well, right? And one of the questions was about the recording. There was a lot of that in here. So yes, we will have the website available on this website, not today, but in the very near future. So check back in a few days. If you have any questions in between, please contact us, students@asppph.org. Questions, however, about the program specifically should be directed to PHAP. We would not answer those. I think that is it. Do you all have any other questions, or do you want to repeat your email address for questions?
And let's repeat our website, but I do want to say this one thing is, being that we're here at CDC, please, we want everyone to be safe. So take a look at our guidelines when it comes to COVID mitigations. Please keep each other safe. Make sure your family is safe. We want to make sure that you can come to our program and do work. So that's my little 5-minute CDC, let's be safe. And Pam, if you want to give the website, that'll be great.
Okay. Now the website was on that last slide. It was the www.cdc.gov.
/PHAP, right there.
Yes, there it is right there, /PHAP. And there is a wealth of information there, all kinds of things. And again, there is a document embedded in there for FAQs. But of course, if there's something, Tracy, either you or Aaron, if someone sends something directly to you, I don't have a problem giving my email address, which is lup3@cdc.gov. I mean, if there's a quick question.
Great. Well, thank you both so much for your time today. I know this was really interesting. Thank you all of the participants for coming and learning more about the PHAP program. So I am excited and I hope you all apply and get placed for the future public health workers. So thank you all. Have a great holiday season.
Thank you. Bye.
Bye.
Now.